Hello and welcome to the Comlex Instant Review. Please visit comlexflashcards.com for additional lectures as well as a blog that will give you daily updates as you prepare for medical school and for board exams. Now what is postpartum hemorrhage? Postpartum hemorrhage is a significant cause of maternal morbidity and mortality. Most postpartum hemorrhages are caused by uterine atony and occur in the immediate postpartum period. Expectant or physiological management of the third stage of labor has been compared with active management in several studies. Now, active management involves administration of uterotonic medication after the delivery of the baby, early cord clamping and cutting, and controlled traction of the umbilical cord while awaiting placental separation and delivery. Good evidence shows that active management of third stage of labor provides a better balance of benefits and harms and should be practiced routinely to decrease the risk of postpartum hemorrhage. Oxytocin, ergot alkaloids, and prostaglandins have been compared as having timing and route of administration of these uterotonic medications. Oxytocin is the uterotonic agent of choice, and it can be administered as 10 units intramuscularly or as 20 units diluted in 500 ml normal saline as an intravenous bolus, and can safely and effectively be given to the mother with the delivery of the baby or after the delivery of the placenta. Now let's review some key terms as we analyze postpartum hemorrhage in detail. What is the third stage of labor? This is the time from the delivery of the infant until the delivery of the maternal placenta. And what is active management? Active management involves uterotonic medication administration after delivery of the baby, early clamping and cutting of the umbilical cord, and controlled umbilical cord traction until separation and delivery of the placenta. What do we mean by expectant management? Well, no uterotonic medication is administered, and umbilical cord is not cut or clamped until or after the cessation of pulsating. So separation of the placenta without intervention, and also placenta delivered by gravity or spontaneously by maternal expulsion, all leads to the definition of expectant management. How about postpartum hemorrhage? Well, the correct definition is blood loss of at least 500 ml within 24 hours of delivery. And severe postpartum hemorrhage includes blood loss greater than 1000 ml within 24 hours of delivery. Keep in mind, the uterotonic medication is any medication like oxytocin that causes uterine contractions. Again, prophylactic use of uterotonic medication involves uterotonic medication used to prevent postpartum hemorrhage. Keep in mind that therapeutic use of uterotonic medication includes uterotonic medications used to treat postpartum hemorrhage. So these definitions will help you understand the management of postpartum hemorrhage, because you'll understand what everything stands for, and it'll give you a clear idea of how to approach questions on the board exam. What are the risk factors for postpartum hemorrhage? Well, prolonged third stage of labor, preeclampsia, mediolateral episiotomy, previous postpartum hemorrhage, and twin pregnancy are all risk factors, including, some of the other risk factors that have a lower odds ratio. So what are the clinical recommendations now for patients who have postpartum hemorrhage? The recommendations are that the practice of active management of third stage of labor during obstetrical delivery to prevent postpartum hemorrhage is key. Active management, as we said, involves prophylactic administration of the medication, early clamping and cutting of the umbilical cord, and again, controlled cord traction. For the prevention of postpartum hemorrhage and in conjunction with other components of active management of third stage of labor, oxytocin can be administered with the delivery of the anterior shoulder or after the delivery of the placenta. Again, the recommended dose is oxytocin 10 units intramuscularly or 20 units diluted in 500 ml normal saline intravenously to prevent postpartum hemorrhage in the third stage of labor. Oral prostaglandins should not be used for the prophylaxis of postpartum hemorrhage, and that's a key point that you can have on one of the test questions. So this was just a basic overview of postpartum hemorrhage and some of the key points you need to keep in mind, including the definitions and the management of postpartum hemorrhage. Please visit comlexflashcards.com. Again, that's comlexflashcards.com for complete Comlex prep resources as you prepare for the board exam, and good luck in your preparation for the boards.